Joining us today is Dr. Lorraine Sharp. She is a medical doctor at the Group Health Center in Sault Ste. Marie. Dr. Sharp has been practicing family medicine since 2011, and she is also a friendly face that you may see at Sault Area Hospital. Welcome, Dr. Sharp. Thank you for joining us today.
Thank you so much for having me.
So can you tell us a little bit about yourself and why anxiety is an important women's health topic for you?
Yeah, absolutely. Thanks so much for having me on this show. I appreciate it. I came to Sault Ste. Marie in 2009, and I've been practicing family medicine since 2011, and I've got a certificate in care of the elderly as well. And I think we can all agree that anxiety is really prevalent in Canada. And I think for me, I was really excited when you offered me the choice of topic here. I certainly have a lot of patients that I treat for anxiety, but also I've got a little bit of personal experience as well, and I'm happy to share a little bit about that. I started in 2018 getting these really interesting panic attacks when I was in airports. And, I think it's really interesting because as a health professional, I had a lot of insight into the fact that these were likely panic attacks. And I think airports and airplanes are really, really common places to get it. And the intensity of the physical feeling of panic is so strong. I would have this nausea, I would be sweating, and I would have this intense feeling of doom, even though I very much knew that this was a panic attack and that I was very unlikely to die from this. But, the feeling was so intense, and it very much started to create this environment for me where I started not to want to travel on planes. And my family travels a lot, and this was not going to work for us. And so I called my psychologist, and we sat down and we really started to work through, and I just started to learn a lot more than maybe what I had initially learned in medical school about anxiety and panic. And with my medical team, like, I just have a much better appreciation for how intense the physical symptoms can be, how maladaptive some thoughts can be. And I've really gotten a really good handle on the situation for myself. And so it just is a very, I think we have to have so much respect for the human body that, these maladaptive thoughts can create these very intense and unpleasant physical symptoms. And then we get these like great behaviors where all of a sudden we either feel as though, we're at the worst, we're going to imminently die or have a heart attack, or, it's just such an intense feeling for so many of us. And, I think we have to believe that we can manage these symptoms, and we've got to ask the right questions. We've got to educate ourselves. And, I'm very lucky to have the ability to have the support system that I very much have an understanding of my own symptoms, and they haven't taken a hold of my life. But very quickly you avoid a situation, so you don't go on planes, but now you start to experience them in restaurants, and that's what was happening. And so your world gets very small with anxiety disorders and with panic disorders for a lot of people. And so I think knowing what I know now and having that experience, I think that I have a great appreciation for anxiety and the true disorder of it all.
Yeah, well, thank you so much for sharing some of your practice
Yeah,
experience and personal experience as well. And I think,
yeah.
as a healthcare provider, it's interesting when you get that lived experience of a certain
Mhm.
diagnosis or a situation like anxiety, because then you can really empathize and understand where patients are coming from. But it just opens up your mind, beyond a medical textbook to a new
Mhm.
understanding and, like you said, a new appreciation of how intense the feelings could be and
Mhm.
the maladaptive thoughts that can come along with it.
Mhm. Yeah, absolutely. It's so interesting, and very much the the intensity of the thoughts, and recognizing them as not being a part of, they are thoughts that my brain has made up. They're not real. And once you can start to appreciate that, at least for me, that was when I really started to be able to separate out what was simply being created by my mind, and then I get a little bit more control, and then that's kind of the pathway for treatment for a lot of people.
Yeah, definitely. And I think,
Yeah.
as you said earlier too, it's important to acknowledge that it is something that we can treat. We can get a handle on these thoughts, but we have to have the right support system in place.
Yeah, and we need to educate ourselves, and hopefully
Mhm.
that's what we're doing today, right?
Absolutely,
Yeah.
absolutely. So can you define for us what anxiety is, or, the difference maybe between feelings of anxiety versus clinical anxiety?
Yeah, I think that's really important because we all experience stress. We all experience anxiety. We all experience this unpleasant feeling of tension, worry, nausea, cramps when we have too much external stimulus kind of coming at us. And that feeling can last for a little bit, but often goes away. So you're worried about a test, you're worried about a big move. You have the same feelings of stress or anxiety, but ultimately they don't interfere with your social function, they don't interfere with your schooling, they're not interfering with your work, and they're transient, and you can go back to feeling well after. The clinical disorder of anxiety, and anxiety is like a pyramid of disorders that I treat. So we have like our generalized anxiety disorder, and maybe I'll just talk a little bit about that one.
Sure.
And that disorder is where a person has um, an irrational worry or an excessive amount of fear, and it is present on more days than it's not present. It's got to be present for at least 6 months, and it typically comes along, and there's like a nice criteria that the DSM-5, which is like our psychology manual, lays out to say, it's got to come along with usually muscle tension, headaches, a feeling of restlessness, irritability, you're not sleeping well, and it has to interfere with function. And I think that's where that difference between just, anxiety that is healthy, it's normal to get revved up and excited, it helps us perform well, but when it starts to be present and ubiquitous and it's interfering with our ability to function in relationships, it's difficult to work, we're not functioning socially, and it's not due to another medical disorder, it's not due to the use of substances, that is when we are looking at it being one of the mental health disorders.
Okay, that's really helpful clarity to have. And you shared a list of some of the signs and symptoms too that women might experience that are part of that diagnostic criteria. So that's, I think, helpful to know because women listening can relate. Perhaps they may be experiencing symptoms they might, potentially qualify for that diagnosis. Are there any particular women that you would say are maybe more at risk for developing an anxiety disorder than others?
Yeah, I think there's probably even more literature than I know about. I think, when I was looking at who is prone to that first episode of anxiety or a true anxiety disorder, women more than men. I think that's an important distinction. Women who are poor, women who have had trauma in their life. I don't think that's particular to women, but women, being a woman is already a risk factor. And then if you add in some of those other risk factors, having a separation or loss of a parent figure, any sort of loss or trauma, poverty, I think those would be an add-on, stressor in terms of a female. And I think of it too, I was trying to think of an analogy of why certain people, women and men, experience anxiety differently. And I was thinking like with the kids doing these experiments, I think, okay, we use funnels a lot. And, when you think a funnel's got a nice narrow opening at the bottom, and if you think of that opening as your resilience, your resources, it's your underlying health, your relationships and support system around you, your healthcare team, and your ability to cope based on your own personality features. And then you think of pouring like water into a funnel. If you pour a reasonable amount of water and the opening is wide enough, then the funnel doesn't overflow. So if you have a certain amount of stress coming into your life and you've got the right resources, the right support system, then you're coping well. But if either the opening of the funnel gets too narrow because you are in poverty, or you have had extreme loss, or your personality is such where you are more at risk from maybe even genetic factors for anxiety, or the environmental stressor is just too much, now the funnel overflows. And that's kind of the difference between, for some people, it seems as though a less amount pouring into the funnel is still going to create an overflow. Whereas, we meet many people, I'm sure in your practice too, where they are able to handle and manage an inordinate amount of external environmental stimuli and still seem to not experience the clinical symptom of something like a generalized anxiety disorder.
Yeah, I think that is such a helpful example. It makes it abundantly clear, and that maybe the funnel opening is different for different people. So their ability to cope with varying levels of stress may be different from another person. I think that's a really helpful way to look at it.
Yeah, thanks.
And so what are some common obstacles that women might encounter who are struggling with anxiety, maybe in getting support or various other things?
I think one of the main obstacles is, number one, getting the diagnosis, or at least sharing the symptoms that we are having or we are experiencing, and figuring out, is this a level of stress or anxiety that we are experiencing, or do we meet the criteria for a mental health disorder? And that will help to direct your health professional team as to what we are going to advise women. I think there's also, when I was talking to my colleagues and friends about this question, I think a lot of us said, there is an expectation, and maybe it's an internal expectation, that we work, we manage our family, and we just need to do it better, do it faster. And when we're on social media, there's very much a potentially false sense of what we should be able to accomplish and how we should feel. And so there's like my should, which is like, I get all excited when I start to say should, because that's one of those maladaptive thoughts. But I think for women, realizing that there is only your own expectation of yourself and not necessarily that external expectation that we create. I think access to psychotherapy is a huge barrier for women and men, certainly for any, working member of society, accessing after hours psychology, when it means you're going to have to coordinate your work life, your child care potentially, and, trying to insert that into your life. And then the cost, I mean, unless you have a benefit package at this point, a lot of mental health services are available at a fee to the patient. And I think that's a big barrier for a lot of people. And then just being labeled as anxious. So, anytime you bring something up, are you, do you have that concern that someone is going to say to you, oh, but you're just anxious? And you're, trying to make sure that we take away that stigma of saying, oh, I'm anxious. And we might have symptoms of anxiety, but, we chatted about it's really different than saying, I have an anxiety disorder.
Yeah.
And so, I think it's really tricky.
Yeah, I think it's important that we consider and acknowledge the obstacles that women might face in getting help, because if we're aware of them, then we can think of potential ways around them, instead of just feeling in a place like you're stuck and you can't access the care that you need, or excuse me, even get a diagnosis.
Mm-hmm. Yeah, absolutely. Absolutely. And even like, maybe I'll even mention, I think a lot of times too, we seek health care for our parents. We seek health care, we are at doctor's appointments with our kids. We're at doctor's appointments with our parents, but, we need to do a really good job at saying, maybe we actually need our own appointment to check in, and we need to know, what are we asking of our healthcare professionals? Let's write down the symptoms that we're experiencing. Let's make sure that we have an appointment that is a good length of time. Like in my office, I would book 15 minutes, but maybe that's not enough time to really delve into some of these symptoms. So I think it's important And I think it's important for patients and women, to ask the question or bring it up in another appointment for another reason, but then realize that, we'll probably say, you know what, this is a really important topic and I want to delve into it a bit deeper. And so that means I'm going to ask you to come back so that we can chat further about it. And we probably won't necessarily get to the diagnosis in one visit. Often it takes me a couple visits to really dig into the history, do a physical. Sometimes there's some lab testing that I like to do to rule out some medical disorders that can present with similar symptoms to anxiety. So it very much is, a few visits that we have to do together. And it's a big first step. I always try to remember to really congratulate people, like, thank you for bringing this up, because, there are a lot of good treatments that I can suggest and offer, but it's a really big step to actually say, you know what, I just am not feeling well. And maybe women recognize that it is anxiety, or maybe they're just coming to my office, often it's symptoms of headaches or unexplained muscle tension. Sometimes it's not as obvious as what I experienced with that panic attack, where it was, that flushed whole body experience. And sometimes it's just this unexplained irritability and muscle tension and headache. And, we do a lot of other tests trying to work up medical disorders, but I think it's really important that, we open our thoughts to the consideration that this may be some undiagnosed general anxiety.
True. And I think you've just shared so many important points, including trying to lay a bit of the expectations for what the process of diagnosis would look like.
Mm-hmm.
And if we're looking at, women who might be considering, maybe I do have an anxiety disorder, or this is something that needs to be looked at, what's the best way to approach a conversation with your family doctor about it?
Mm-hmm. I think the first thing you need to do is book the appointment. And sometimes that's the hardest step. Like, I remember the first time that I was calling my psychologist back to say, I think I'm having panic attacks. It was like weeks of maybe I'll call, maybe I won't call, and I'm a health professional. I know the treatment that I need. And so I really appreciate taking that first step, call and book the appointment. I think it's very helpful for me if patients have jotted down what symptoms they're experiencing, and then the timeline of symptoms. I think if for some reason that first visit either doesn't go well, or, maybe we're talking about, you book it and we end up talking about maybe another health concern, and then at the end of the visit, we kind of start to talk about maybe some symptoms of anxiety. Often, we will book a second appointment. I think a good way to phrase it is, I'm having symptoms and I want to tell you about them and I don't know what they mean. Maybe you wonder if they're anxiety. But I think as long as you are getting into the office and bringing up your symptoms with an open mind that you may be exploring some thoughts around anxiety, I think that is the first step. Mm-hmm. And I know even with counselors or with other health professionals, if your first visit doesn't go the way you expected, please don't just go away forever. Please come back and let's talk about it in a different way, or let's set you up with a health professional that you do seem to have that good, trusting relationship with, because that's going to be the most important thing, is that you as a patient or a woman are feeling as though you have the confidence in our relationship that we can get the right information, get the right diagnosis, and then work together on a plan. And it's got to be a shared goal plan. It can't be me telling you what you need as treatment. It's got to be you telling me what you hope to get out of that improvement in your health. And then hopefully we have enough time in the one appointment, or we end up working together over some time to kind of work together and get that goal.
So true. I love your approach that it's, team-based. It's not just a one-sided thing. Like, it really needs to be a team approach where you're both on the same page and you're pursuing the same goal. Mm-hmm. I think that's really important to consider. And if we're thinking about, the scope of family medicine, what are types of treatment options that you could offer women who may be diagnosed with an anxiety disorder?
So I'll start with the not talking about the self-care, but I think we'll talk about that one
Yeah.
as well. But the more traditional treatments that we would offer in family medicine would include either medication or psychotherapy. And the medications for anxiety disorder are similar to the medication treatments for depression. And typically they would include as a starting point a group of medications called the selective serotonin reuptake inhibitors, so SSRI, or SNRI. Often medication really helps when the symptoms are so severe, it's very hard to start therapy. So often medication and therapy work well together. For some patients, we choose one or the other for different reasons, but for the majority of people, I'm recommending if we do use medication, it's in combination. And the medications are pretty well tolerated. They take about 4 to 6 weeks before I typically notice an improvement in symptoms. And often we use types of questionnaires to really help to gauge how well we are improving the symptoms of anxiety. The psychotherapy can be done either by a social worker or a psychologist. And again, cost is often a factor, benefits is often a factor. And usually that is using something called CBT, so that cognitive behavioral therapy. And that goes back, I think, to what we were initially talking about, which is that a group of maladaptive thoughts saying things like, I'm never good enough, I'm always, losing, I should do this, you predict the future, I will never do this. So trying to help you realize that thoughts, a friend was telling me from a book, they're like this unwanted, unhelpful roommate that just like chatters in your brain all the time. And if we can recognize them as being separate from who we are, then they won't necessarily generate the feeling of the anxiety. And if we call them out on being unhelpful and recognize them as being maladaptive, then they may not generate that same feeling of unpleasantness and tension. And then we don't necessarily have to act in our, avoidant or escapist behavior, which is really what creates that little circle of, well, if I get out of the room because I'm claustrophobic, something really terrible must have been happening, so I'll never go in a small space again. And then we enter that circle of anxiety, which is just so debilitating for so many of our patients.
Very true. And I know you wanted to speak to self-care too, so let's explore that a little bit. What are some self-care strategies that a woman could potentially implement right now to improve her well-being and reduce anxiety?
Yes, I love self-care because for the most part, it comes at no cost. We can do it with exactly what we have around us. And there are some good studies to say that, getting out in nature, starting an exercise program, participating in mindfulness, and there's a bunch of free apps on the internet, that you can learn a little bit more about that. But there's good evidence that those things can reduce the symptoms of anxiety on their own. So I'm often trying to tell patients, when you have symptoms of anxiety, the worst thing we can do is give up all the things that actually make us feel good. So we stop going to the gym because we get too busy. I'm like, no, that's the opposite of what we should be doing. We need to exercise more. We need to be outside. We need to recognize that this is a normal experience that has to be one of the most common reasons that people come to see me in the office. That mindfulness is really, it's that focus on the here and now, whereas anxiety tends to be a worry about the future. So if we can refocus ourselves to what's happening in the present, the sound, the smell, the touch, we can create these visualizations of positivity. All of those things very much can help our symptoms of anxiety. We can look at how much caffeine we're taking in. We can look at whether or not maybe we're using marijuana in not a healthy way. That itself can bring a lot of anxiety symptoms. Are we drinking alcohol in excess? Are we eating a healthy diet? Are we keeping a healthy weight? There are a lot of things that I think we do have control over when it comes to anxiety disorders. And we don't want to sabotage the efforts of medication and the efforts of psychotherapy by not doing a great job at taking care of our bodies.
Yeah, absolutely. I fully agree. Like those lifestyle pieces are so foundational and they
Mhm.
support the other treatment options that you might be pursuing to help with reducing anxiety. And for the most part, it's just, some education around what are the tools, and primarily they're free for the most part, or even just accessing your breath or remembering
Mhm.
to be in the present moment, those mindfulness practices too. So there's so much, I think, to really explore there. And I thank you for sharing those ideas.
Mhm.
I'm also wondering, because resilience is a topic that is very close to my heart. I love talking about it. And it's also something that's very important for women's wellness.
Yeah.
What does becoming more resilient mean to you? And how does it relate to some of the women that you treat?
Yes. It took everything in me not to be like, what is the definition of resilience? So I just totally resisted the effort to have control and have this beautiful answer. And I was thinking about it. And I think it goes back to the funnel. You know, do you have the tools that you need to adapt to more of the world coming at you in your funnel and being poured in? Can you adjust that, outlet of the funnel to adapt for times when everything is coming in and you have no control over, the external world? Can you continue to be true to yourself and adapt and ask for help? And I think that's what it means, is having this moving target of what your wellness is, to really allow for whatever is going to come, and making sure that you can move with it. And it's not going to be perfect. There's going to be times, I think, where that funnel is going to tighten up and everything's going to overflow and things are going to be terrible for a little bit of time. But recognizing that, if we just come back to kind of our good practices, then for a lot of us who are in that, range where we have that stress and anxiety, but maybe we don't meet that full criteria for an anxiety disorder, the strategies of self-care are just still so important, because again, that stress and anxiety can quickly turn into a disorder, if we don't address the neck of the funnel and we don't give ourselves the tools that we need to be functional and to be our best. We shouldn't just kind of go through life and expect that we should feel this stressed all the time. I think that we can work hard, to create that resilience for what's coming at us.
Very true. And see, without the help of a dictionary or textbook, that was a beautiful answer.
Thank
And
you.
it comes back to that great analogy that you use with the funnel. Like, how can you maybe open the funnel more to allow more things in, or try to restrict, the entry of perhaps the stresses into the funnel? I think that's really important to think about. And I love tying that to resilience. I think that was really beautifully said.
Yeah, thank you. Soon we'll have a funnel with extra things on top, and yeah, there'll be a diagram. Yeah.
Absolutely. Well, thank you so much, Dr. Sharp, for sharing your story today, sharing all your wisdom and knowledge. I have no doubt that this is going to really benefit many women.
Good. Well, thank you so much for having me, Tara.